It is 11 o'clock. Good morning, everybody. Welcome to the Funded Center Orientation. My name is Gabby. I am the Business Operations Manager for the Georgia Trauma Commission. Katie has also joined us. She is the Finance Operations. What is it, Katie? Finance Operations Officer. I almost said manager. And then Gina Solomon, the GQuip Director, will be joining us later today. So for today, we will be reviewing a little bit about us, meetings overview, contract overview, PBP and the scorecard, as well as a GQuip overview. So starting off, we were established in 2007, so we're a pretty young agency. We were established by Senate Bill 60. The bill charges us with establishing, maintaining, and administering a trauma center network to coordinate the best use of existing trauma facilities and direct patients to the best available facility for treatment of traumatic injuries. We're also charged with participating in the accountability mechanism for the entire Georgia trauma system, primarily overseeing the flow of funds for system improvement. Our mission is we are dedicated to improving the health of injured Georgians by ensuring access to quality trauma care, coordinating key trauma system components, and educating trauma care providers across the multidisciplinary continuum. Vision, the Georgia trauma system will become a top-tier trauma system that provides the highest quality care and education through discovery and innovation. And our values are stewardship, so managing resources responsibly, integrity demonstrated through accountability, ethical behavior, transparency, and reliability, and inclusivity, ensuring teamwork and collaboration with our diverse stakeholder group. Our Georgia Trauma Commission consists of 9 appointed members. These members are appointed by the governor, lieutenant governor, and Speaker of the House. And I do want to honor Regina Medeiros. Sadly, she passed away in August. She was our vice chair, and if you knew her, you knew she was one of the biggest advocates for trauma care improvement in our state. And her dedication will continue through many aspects of our commission work. The Georgia Trauma Commission also has a staff. Gina Solomon to the left is our GQuip Director. Crystal Shelna is our Regional Trauma System Development Manager. My name is Gabby again, a Business Operations Manager. Elizabeth Atkins is our Executive Director, and Katie Vaughn is our Finance Operations Officer. So we get a lot of questions regarding the various entities in the state. You'll see our logo a lot, Georgia Trauma Commission. Again, we are the funding and accountability mechanism for the system. We're also the parent to the Georgia Quality Improvement Program, and that is the outcomes entity, the state TQuip collaborative. And then DPH, Office of EMS and Trauma, is a separate entity, and they're responsible for the Georgia Trauma Center designations. Our funding revenue sources, the majority come from Super Speeder. And then we have a small amount that comes from the fireworks excise tax. Distribution, so I added this from our last year's budget. 73% went to trauma centers, 15% to EMS, 8% to system development, and 4% operations. And I will be sending this PowerPoint out to those who registered so you can see this a little bit more clearly. It's probably very small, but we're very transparent on the allocations to the trauma centers. So you will see the total amount that each center received last year. We have 300 plus trauma system leaders and stakeholders collaborating to improve trauma care in Georgia. And what that looks like, the Georgia Trauma Commission, we fund the RTAC coordinators. We also fund the Georgia Trauma Foundation's operating costs. And we have a wide range of committees for the commission, which many of you are probably a part of. The GCTE is one of the committees that has several subcommittees: injury prevention, performance improvement, trauma registry, pediatric education. And we also have the Georgia Quality Improvement Program under the Trauma Best Practices Committee. I'm going to go over the meetings because you get a lot of emails about those. So I highlighted in yellow the TPM meetings that are tied to PBP. So we have the Georgia Committee for Trauma Excellence, the Level 3 and Level 4 Rural Committee, and GQIP. The ones in blue are also tied to PBP. Those are the Trauma Administrators Committee and then the Trauma Medical Directors Committee. And we'll go over PBP later on in the slides. So the purpose of our committees is the commission tasks each committee with making recommendations to the Trauma Commission that are impactful for the commission's mission of developing a statewide trauma system and minimizing a patient's time to care in Georgia. Just an overview, we do post the meeting information 48 hours before the meeting to comply with the Georgia Open Records Act, and that is through our commission website. Membership for each committee varies by committee, but all meetings are open to the public. And then scope, the Trauma Commission at any time may request a task be taken by a committee. The committee will then be charged with making a recommendation to the commission or provide updates within a given timeline. And as I mentioned, PBP meetings for TPMs, we have 2%. I believe this is for level 1s and 2s. Each level has a different percent allocated. GCTE committee attendance is 75%. We also have GQIP summer and winter meetings, the in-person meetings. And then in-person participation at National TQIP, which is actually coming up in November, or pediatric centers can attend the Pediatric Trauma Society conference. So the meetings, what are they? So meetings with assigned center representation or their assigned center representation. Attendance is tracked and tied to portions of a center's funding. Why? It's to ensure collaboration and networking. And then who? Attendance requirements vary by meeting. And then when most meetings occur quarterly. And then the majority of the meetings are conducted via Zoom. And we do have some meetings that we have hybrid or an in-person requirement. And here again, we are emphasizing the assigned GTC meeting representation. So for TPMs, we have the GCTE, the summer, GQIP or fall, and then we have the GQIP winter, spring. Sometimes previously we had a mixed up cadence, but for the majority, it's a GQIP summer and a GQIP meeting winter attendance. Unassigned GTC meeting representation, we have our level 3s and 4 meetings, and those can be anybody from the level can attend those meetings for credit. And then one GCTE subcommittee, again, anybody in the trauma program or facility can attend those meetings for credit. Going over the GQIP meetings. So these meetings occur quarterly. We have 2 in person and 2 virtual. The members consist of TPM, TMD, and PI coordinators. Attendance requirement varies by meeting. For example, the next meeting is going to be in-person winter meeting. It's going to be a full closed session, so we'll have just the TPM and TMDs required to attend only. That's going to be February 20th, 2026, and it is on my list of to-dos to send a save the date and get that registration information out to you guys. And just a note that in-person meetings have a closed session, so those are limited to licensed personnel. Here's an example of the GQIP schedule sample. So we do trauma center spotlights, best practices, scientific sessions, and then the closed session, which is protected for peer review. GCTE, again, quarterly cadence. We have 2 hybrid and 2 virtual meetings. The members include TPM, PI coordinators, registrars. Attendance requirement is a TPM must attend at least 75% of the meetings. The next meeting is going to be virtual, October 30th, 2025. And just a note, it does have 5 subcommittees, and that's open to anyone. Level 3, Level 4 committee quarterly, we have 3 virtual and 1 hybrid. The members include Level 3, Level 4 TPMs, TMDs, and administrators. The attendance requirement is the Level 3, Level 4 center representative during each meeting. And the next meeting, we have a hybrid meeting, November 20th, 2025. The in-person meeting will be in Cordele, Georgia. And then they discuss topics specific to Level 3 and 4 centers. Recording your attendance. So we are very QR code heavy. So ensure you scan your QR code before or after a meeting. Zoom will also have the link posted in the chat if you can't scan. And if you ever have difficulty scanning or with the link, please email us to record your attendance. That is how we validate your PBP. And then Smartsheet email notifications. We use it to automate reminders and tracking notifications. So you may receive emails reminding you of a deliverable that's due or to note your attendance for a meeting. And then our website, you can use our website to locate the meeting items, Zoom links, and recordings. Committee members do receive an official calendar invite, but again, it's open to the public, so you can get the link through our website. And then I will hand it off to Katie to review the contracts.
All right. The first thing with the contract overview is the active fiscal year is July 1st through June 30th. Funding supports registry, readiness, and uncompensated care. And right now, currently for level 1s and 2s is the only level that has the uncompensated care available. For readiness funding eligibility, ACS verification and state designation reminder is below. Level 1 must maintain their ACS verification, level 2 as well. And then 3 is maintain state designation. ACS verification will be required by June 30th of 2027. Level 4 is the same, maintain state designation, and burn, maintain ABA verification. And then other funding eligibility requirements are in the contracts. The next section is the PBP criteria and scorecard. Performance-based pay is a payment model that offers financial incentives to contracted trauma and burn centers for specific performance measures. This is the table that is in your contract, and it shows the criteria by each level and the criteria for all levels. I'm not going to go through line by line, but if you have any questions on your contract, please let us know. For level 1, 80% is at risk. Level 2, 80%. Level 3, 60%. Level 4, 17%. And burn is 50%. The readiness amount in your contract is tied to previous performance. The at-risk percentage of funding indicates how much can be withheld based on non-compliance or lack of participation. For FY26, the scorecard that you will submit will impact funding for FY28. So we're going from the second subsequent year instead of how it used to be. It used to be current year, and then we went to previous fiscal year, and now we're moving into the second the year after. So FY26 will impact funding for FY28. Select's PBP criteria will be tiered for this year. So the impact won't be if you miss a meeting, you get 0% for that. We did change that for this year. PBP score will impact funding in the second subsequent year. As we just talked about, FY26 will impact FY28. And then there are a couple of new GQIP outcome measures. Time to first dose BTE prophylaxis, and then time to surgical repair and geriatric isolated hip fractures. And if you have any questions on those, Gina will be able to help you with those. And here is the scorecard. It looks a bit different this year with the tiered criteria. So if you need any help filling that out, please feel free to reach out to us. It is due August 30th of 2026. The date did change, so just please note that. Submission is required to determine the PVP achieved within the fiscal year, and then the score affects the future funding amount. Your current performance is your future economic reality. And some upcoming contract due dates, September 30th for level 1s and 2s, the readiness cost survey is due. And this is a tool designed to collect financial data from designated trauma centers to assess the costs associated with maintaining 24/7 trauma readiness. January 31st, 2026 is your first biannual invoice, and that will be when you invoice for your registry funds. Then July 31st will be the second biannual invoice, and that's when you will invoice for all remaining funds, readiness, performance-based pay, if there's any additional funds that were given after your amendment is sent out, then you would invoice for those as well. Also, your trauma center actual use report will be due July 31st. That was new in 2025. And then August 31st, 2026 is when your scorecard is due. In your contract, you have Exhibit 4, and this is your timeline just to go by, and it will show you when everything is due is the dates we just went through. September 30th is readiness cost survey for 1 and 2. January 31st, first biannual invoice. And this is something you can print out and just have it as a reference tool. And then the next is an example of the invoice. For the first biannual invoice, all you will be submitting is your registry service program. So in current expenditures request, you will put that total for your registry and that total, and it will total at the bottom. There are no prior cumulative since this is the first biannual. And then down at the bottom, you will print your name, sign your name, and then submit it to GTC Business Ops. This year for FY26, there's no deliverables template. You will no longer be required to submit that. And then, as mentioned, submit your invoice to GTC Business Ops at gtc.ga.gov. This is an example of the annual actual use report that you all are familiar with from this year. It is due July 31st, 2026. And I'll turn it over to Gina for the GQIP overview.
Good morning, everybody. All right, we'll go through the GQIP structure a little bit. GQIP was formally established in 2016 with funding supported by the Georgia Trauma Commission. It actually includes both the trauma and surgical quality collaborative statewide. It operates under the Trauma Best Practice Committee. I know Gabby showed that on the organizational chart, and that may be kind of a new thing, or you're like, I haven't heard of that. And it really was established in 2022 as a way to create a structure that keeps our the things that we do protected under the peer protection statutes in Georgia, and not discoverable under the open records that state offices are subject to. So that's why that structure was put in place for us. So we are not subject to open records, and we can do the work we need to do and freely for that. So our structure includes really 3 medical directors. So we have 2 for trauma. Dr. Alexis Smith is our trauma medical director. And then our second trauma medical director is Dr. Patricia A. Young Chi, and she is over like data quality analyst and research. And then the surgical quality arm is Dr. Joe Sharma. We also, as a part of GQIP, have a research fellow. We have had this as a part of GQIP since 2020. Dr. Hillary Jessup, she is I believe our 4th fellow now. And this is funded by a Georgia Trauma Commission grant. They work with both the trauma and surgical collaboratives to help us advance some quality initiatives and do some research projects. They are usually surgical residents that are doing a year or 2 of research with that. And then this year, I am very fortunate to have Sarah Parker join us a few hours a week to help push our work forward with GQuip to do some data collection and analyzing and work on projects within GQuip. GQuip is also listed as a patient safety organization within the Agency for Healthcare Research and Quality. And why this is important and something that we did is it provides us a broader federal protections for the quality work we do. So not only did the best practice committee that we created in our structure make sure that we are well established to get the peer protections for Georgia, and we are not subject to open records, the work that we do, but we work to become listed as a patient safety organization to make sure that we have this broader federal protections for the quality work that's done within GQuip. If you're interested in some more information on PSOs, you can go to the website and there's some more information there. A lot of hospitals are part of broader PSOs within their health systems and that. So GQuip has a central data repository, and we also support the Arbormetrics platform. So we launched this benchmarking platform in 2020. It was actually a $1.5 million project to develop a risk-adjusted benchmarking platform that the commission supported. And there's 2 components to that. There's the GQuip central site. So GQuip receives each center's trauma registry data, similar to what you submit to OEMS&T. We are a ESO v5 central site, so we have the same platform that the trauma centers have, and we did that on purpose, so we makes receiving the data as seamless as possible, and it's apples to apples in getting the data. And this is something we have partnered with MTQuip, which is the Michigan collaborative. They have been doing this very similar work for well over 10 years. This was something we learned from them, that you got to have raw data to be able to make this Arbormetrics platform work. And then I create large files out of the central registry. I have a report writer, just like you guys have, and I create these large CSV files and send them securely with a secure file transfer process to Arbormetrics, in which they upload and provide the analytics that we work with them to build. And we have access to all the centers in the Arbormetrics platform that we see. And then every center has access to their own data and can see their center compared to everyone else. All GTC funded centers must submit their data quarterly. And we are on the same schedule that you submit your data to TQuip if you're a level 1 through 3 center, or the state. So you don't have to memorize a whole lot of dates on that. And as I said, centers can access their performance data through Arbormetrics. And we are continuously building and adding new metrics to the platform. So it is work. The goal with that is, once the data is submitted quarterly to the GQuip central site, is I review that data, make sure that there is nothing that is missing, that I have everyone's data. That's why there is a requirement to send the PRQ data entry report with your download, so I can see how many records is supposed to come over, and I can compare that to what's in the central site, so I know I have all your data. that there's nothing missing that's important to the analytics within your data, and then send the file, and then hopefully it is uploaded to Arbormetrics within a month to 6 weeks after we receive the data. Access is required to the GQuip Central site to perform downloads to the site. If you have a new registrar or a new person that is going to be doing your data downloads to the GQuip Central site, then you can email me and I can give them access, give them a login to be able to do that. And there's also a video that will walk them through how to do the downloads. And there's also a tutorial file they can have access for that. Access to the GQuip Arbormetric site can be provided by myself, or each site trauma center has an administrator which has been set up as the trauma program manager at each center. I can reset passwords for logins, and so can the facility administrators, which are the trauma program managers, as long as they can still access the site. Once the GQuip Arbormetrics accounts have been activated, if there's issues with authenticators, unfortunately, I cannot help with that. And you have to email help@arbormetrics.com and they can help you reset your authenticators to be able to access that. So just some miscellaneous things. I know Gabby did a good job going over the meeting cadence and talk about the in-person meetings for winter and summer for GQuip, and a little bit of the structure with those. We do work to make them as valuable to folks, because I know your time out of the office is kind of hard to come by. So we do want to make those valuable. And so the structure may change a little bit as we get more data to go over. We learn new things and get feedback from our members on what may be helpful. The TQuip performance matrix, that is something that is also on your PBP, and those are relevant to the level 1, 2, and 3 centers. Actually, I have one that is out right now for the fall report to the centers. What that is you providing information back specific to your TQuip reports. So those will go out in the fall and the spring when you get your TQuip report. And I will, since we don't know exactly when those come out, they're just usually a surprise when we get an email. They're not specific dates around those that we can provide, just that they are due within the timeline that I request with that. Site visits and Arbormetric help sessions. Dr. Smith is trying to get us out there and visit centers. We find those very helpful. We want to hear from you guys and what we can assist with. So don't be surprised if we reach out to want to come visit your center and see how we can help improve quality. You know, what can we assist you with, bring to the table? What ideas do you have? And then Dr. Young Chi is actually reaching out to individual centers to help you sit with Arbormetrics, learn how to use it. What questions do you have? So she's been reaching out to centers as well. GQuip actually has a web page as part of the commission's web page, and you can see the site address there that has some resources there. Gabby recently uploaded all the TQuip practice guidelines there for us, and we add some of the state guidelines and other things as well. Also, what lives there is the GQuip data resource page. This is where the GQuip data dictionary lives, the data download dates, and some other important things related to data. I think that's all I have for GQuip.
Yes, thank you, Gina. So today we reviewed a lot of information. We went over about us, meetings, contracts, PBP and scorecard, and GQuip. Does anybody have any questions or need further clarification on what we reviewed today? I hear no questions or see no questions.
Don't be shy.
While we're here, you can reach us by email if anything comes up or if you have any questions. I know once the invoice due date comes up, it can be like you've never seen it before. So we have this session recorded and I can send out the PowerPoint with the recording so you have it as future reference. And we have some upcoming orientation. We're trying to do this quarterly. So the next one is January 16th at 11 a.m. And we also have April 10th at 11 a.m. And then you can follow us on social media. There's a Facebook QR, LinkedIn, and then we also have a newsletter. And without any questions, I hope you guys have a happy Friday and a great weekend.
Thank you so much.
Thank you.
Thank
Bye.
you.